All right, we're up and running on YouTube, and we'll get started here in about one more minute. Allow any latecomers to join. Be sure to log into the Kahoot that you see on the screen, and we'll get started shortly. All right, it is 11 minutes after the hour. Let's rock and roll here. So everybody, welcome to Spring 2024 Trivia. Uh, just like always, we will get started. Everyone has a chance to win some Amazon gift cards. So let's rock and roll. All right. This is not the first question, so you don't have to worry. Just welcome to Spring Trivia 2024, presented by the predentmentormap, which is created by students of dentistry. I don't know if Brendan wants to take a moment to chat and introduce everybody to our sponsor today. Oh yeah, I got to be able to unmute you. There you go.
Oh, hey, awesome. Thanks, Steve. Guys, thanks so much for coming out today. We really appreciate you coming out, supporting us, and we want to support you with a little bit of knowledge, a little bit of fun trivia here with Dr. Roth. And so the Pre-Dent Mentor Map is a free service for pre-dental students. Get some insight about each dental school throughout the United States. Has live data. We're currently working on updating the match rates or stats of some of the dental schools. We have several so far, so we're working on that over this next year. And it's a free service for you to get some insight and ask questions to current dental students about their school. If you are a current dental student, we'd super appreciate it if you could sign up. But without further ado, Dr. Roth, thank you. Let's do it.
Perfect. Thank you very much. And it looks like we may have our summer date already tentatively set for the 17th of July. So be sure to mark your calendar. We'll be coming to you on the 17th of July. And just a quick plug. Here we have our rules. As always, this is going to be 15 multiple choice questions to test your oral pathology skills. Now, April is Oral Cancer Awareness Month, which means that all questions today, all 15 questions, will be related to oral cancer. You will have 20 seconds per question, and the quicker you answer the question, the more points that you will be allotted. Now, accuracy is always most important, but so too is time. So whoever can answer the correct answer with the correct answer in the quickest amount of time will earn the most amount of points and be our winner. of course, that plug that I was talking about. Be sure to follow us on our social media accounts, Students of Dentistry, PredentmentorMap, Dose of Dental Podcast, Top Dental Practices, Elite Dentists, and of course, I'm your host, Stephen Roth DDS, on both Instagram and YouTube, where we are streaming live. Just a word of caution for those that are streaming on YouTube. It may be best if you join the Zoom because there is a few second delay, so that might impact your score. But if you're just following along, then welcome and enjoy. So we're going to start with a poll. This is not worth any points, but we just want to know which option best describes you. Are you pre-dent, pre-med, or other? Are you a dental medical professional student, a resident, or a practitioner? So we'll get everybody used to Kahoot and find out who is playing this evening. Everybody lock in your answers. Let's see who's on. A lot of dental, medical, and professional students, no practitioners, but we do have a resident and 5 pre-dents, pre-meds, or others. So we've got a lot of learners on the call tonight, which is great. We'll have a lot to learn tonight about oral cancer. So with that, let's jump right in with our first question. What is the most common malignancy of the oral cavity? The most common cancer pictured here. Is it squamous cell carcinoma, lymphoma, mucoepidermoid carcinoma, or rhabdomyosarcoma? So what is the most common cancer? That's absolutely right. Quick to the draw, squamous cell carcinoma is the most common malignancy of the oral cavity. So now that we know that, we'll look at our scoreboard first. Richie taking an early lead, but everyone nipping at Richie's heels here. So what is the second most common malignancy of the oral cavity? Same choices: squamous cell carcinoma, lymphoma, mucoepidermoid carcinoma, or rhabdomyosarcoma. Which is the second most common? Very good. That's right. Lymphoma. Now, mucoepidermoid carcinoma is the most common salivary malignancy, but lymphomas are the second most common type of malignancy to occur in the oral cavity. So very good to those 5 people. Let's see how it affected our leaderboard and if anything was shaken up that round. Yeah, total new top 3 with Chris taking the lead, David in second, and Britta in third. Tough question, shaking up the lead, still early, 13 questions to go. It is anybody's game. So let's see that third question. Brachytherapy is delivery of radiation via what mechanism? Is it through a filtered lens, through intermittent pulses, through proton separation, or through direct contact? Brachytherapy is a type of radiation used in different types of cancers and can be used in oral cavity cancers. How is brachytherapy delivered? Let's see how we did. It is delivered through direct contact. That's right. So brachytherapy is the delivery of radiation through the use of radioactive materials placed right next to or into a tumor or the tumor bed. The quintessential example of this, I'll show you in a second, but Chris maintaining that lead with Clay and Abe switching up that top 3. The quintessential brachytherapy is prostate cancer. In prostate cancer, seeds are often placed to emit radiation to kill that prostate cancer. In the oral cavity, it is not common, but can be used. So the placement of these seeds can be used in oral cavity cancer, and that is brachytherapy. So question number 4. Which of the following malignancies can occur inside the mandible, in the bony mandible? And here's a picture of it here. Metastatic breast cancer, mucoepidermoid carcinoma, rhabdomyosarcoma, or all of the options. Which of these can occur in the bony mandible in a similar style that you can see in this panoramic radiograph? Very good. Yep. All of these can occur inside the mandible. Metastasis, especially breast cancer, prostate cancer, and other metastatic cancers from other parts of the body, can show up in the jaw. Intraosseous mucoepidermoid carcinoma is rare, but does happen with some frequency. And same with rhabdomyosarcoma. Rhabdomyosarcoma from skeletal muscle can occur inside the bone. A very rare subtype can occur inside the bone. So all of the options is correct. Congrats to little Donna, the highest climber here. Little Donna, way to go. We got Clay keeping his lead. Clay's coming back. It's a few seasons ago, Clay came in first, and I think he's hunting for that first place spot again. So will he reclaim his title, or is Chris going to give him a run for his money, or maybe someone that hasn't even entered? Britta just popped right back into that top 5. So it is a tight race and anybody's game. Still very early. Let's keep on trucking. Number 5, which of the following is a PD-L1 inhibitor and an emerging chemotherapeutic in oral squamous cell carcinoma? Here's a picture of an oral squamous cell carcinoma. Is it cisplatin, Keytruda, Erbitux, or fluorouracil? Maybe you've seen commercials for this drug on TV, especially late at night. They like to play this drug's commercial late at night. The answer is Keytruda. Keytruda is a PD-L1 inhibitor and is more commonly being used in squamous cell, especially squamous cell that is more advanced, including metastatic or failing initial treatment. So a tight game. Wow, a shakeup in the top 3 with David taking the lead and Richie close behind. Talking a little bit more about chemo and oral cancer, cisplatin is a platinum-based drug. Essentially, this drug gets incorporated in the DNA, which disrupts it, preventing it from replicating. Erbitux is a monoclonal antibody against the epidermal growth factor receptor. And then fluorouracil is a metabolite. You might remember uracil as a amino acid, rather a RNA, and it is cytotoxic. So whenever it's incorporated into protein structures, it actually prevents that protein structure from occurring and can be cytotoxic. PD-L1 is kind of like a cloaking mechanism. So when a T cell is going to get rid of cancer, which is one of its jobs, if the cancer is presenting PD-L1, then it stays hidden. The T cell doesn't kill it. But if a PD-L1 inhibitor like Keytruda gets in the way, then the cloaking mechanism or the cloaking device is removed and the T cell can recognize that tumor cell and kill it. So this has become an increasingly important drug in the treatment of oral cancer and also used in lung cancer. That's why a lot of times you'll see Keytruda commercials talking about non-small cell lung cancers, but increasingly being used outside of the lungs, including the oral cavity. True or false? Chewing betel nut with or without tobacco increases the risk of oral cancer. So here we have a picture of the betel nut used in betel quid or gutka or pan, and it is included in some of these with tobacco and slaked lime. Sometimes it doesn't contain tobacco. So is the risk increased with tobacco and without tobacco, or just with tobacco? Correct. So the betel nut itself is carcinogenic. So even if that gutka or pan doesn't have tobacco, it still comes with an increased risk of cancer. If you have a prominent South Asian population, those from India, Malaysia, Indonesia, this is pretty common in that population and can present with scarring of the oral cavity and a much higher risk of oral cancer. And a switch up in 4th and 5th place. Congrats to Brendan, our highest climber, up 5 places. Way to go, Brendan. Top 3, staying steady. On to 7. What colors are on the head and neck cancer awareness ribbon? Pink, pink and blue, burgundy and white, or teal and white? Pink, pink and blue, burgundy and white, or teal and white? Very good. Burgundy and white. I'm trying to remember one of these. Okay, good. So let's see how we did. Oh, we skipped it, but here's a head and neck cancer ribbon. Teal and white is cervical cancer. Pink, as we all know, is breast cancer, but I learned today when I was making this question that pink and blue is actually male breast cancer, so breast cancer in men. But the burgundy and white is the official ribbon color of the head and neck cancer ribbon, and it is Head and Neck Cancer Awareness Month, so I wanted to bring that to everyone's attention. All right, more than halfway done. Mucosal melanoma of the oral cavity is automatically what stage at minimum? Sorry for that grammatical error there, but what stage is mucosal melanoma at minimum? Stage 1, 2, 3, or 4? We give cancers different stages based on severity, where 1 is the least severe and the best outcome, and stage 4 is the most severe and the worst outcome. Mucosal melanoma is at minimum automatically stage 3. So it automatically has a worse prognosis than a lot of other cancers that affect the oral cavity. Automatically stage 3 and can be stage 4, but it is at minimum stage 3, which is what makes this a pretty nasty oral malignancy. Definitely behaves worse than melanoma of the skin. So let's see. Oh, a shakeup. Clay's scrapping for that #1 spot, and Britta has re-entered the top 3. David and Richie fallen, but remaining in the top 5. Congrats to those 5 players with a answer streak. Very good. These are definitely a little bit tougher, but we're learning a lot about oral cancer, which is important all year round, but especially in April during Oral Cancer Awareness Month. Which of the following syndromes has an increased risk of oral cancer? Li-Fraumeni syndrome, Lynch syndrome, dyskeratosis congenita, or all of these options? All of these are syndromes. None of these are made up. Which comes with an increased risk of cancer? Is it all of them or just one of them? And let's see how we did. Of course, it's all of these syndromes have an increased risk of oral cancer. So there are several other syndromes not named here, but this is why it's always important to get a detailed history and ask about family history. Is there any cancer in the family? And if so, what types? It might help you catch one of these syndromes. A shakeup. We've had a onslaught up here in the top 5. A lot of switching around, and congrats to 4 players now with a answer streak. Good for you. Still anybody's game. We're only just about 2/3 of the way through. With here, question number 10. Which U.S. president pictured below had an oral cancer? Grover Cleveland, William Howard Taft, Zachary Taylor, or Chester A. Arthur? Who had oral cancer? There were actually 2 presidents that had oral cancer. One is pictured below. The other one is not listed. Don't worry, not a trick question. This was Grover Cleveland. Grover Cleveland. Believe it or not, Grover Cleveland was treated for his oral cancer on a yacht. He wanted to keep his cancer secret, so they snuck onto a yacht in the middle of the night and did his cancer procedure there. Nowadays, we would call his type of cancer verrucous carcinoma, but it resulted in part of his maxilla being resected and an obturator, which is a removable denture that closes the hole, being placed. Chris maintaining that top spot, but David and Clay inching their way forward. Ahmed is the highest climber. Congrats, Ahmed. Just a few more things about Grover Cleveland. His tumor is actually on display in Philadelphia at the Mutter Museum. If anyone's ever been, it's very cool. I went within the last year, and there are a ton of really cool and gnarly health artifacts, one of which is, believe it or not, Grover Cleveland's tumor in a jar on display. And if you want to learn more about this story, there are several novels, not novels because they're nonfiction, but several books on the subject. And I even covered it in this YouTube video. So if you're interested in learning more about this really cool story in American history, then you can check out my YouTube video or read one of those really great books, or go to Philly and see it in person. It's really cool. Final stretch. HPV is most likely to cause a cancer in which of the following locations? The gingiva, the tonsil, the ventral tongue, which is the underside of the tongue, or the soft palate. I know we have some predents. The ventral tongue is the underside of the tongue. HPV stands for the human papillomavirus, which is a risk factor for cervical cancer, but also tonsil cancer and base of tongue. So HPV is a risk factor for oropharyngeal cancer. And oropharyngeal cancer is the very back separating the throat from the oral cavity. It does not increase risk of oral cancer. HPV is found in only about 4% of oral cancers, which include the gingiva, ventral tongue, and soft palate. The tonsil and the base of tongue are common sites for HPV-related oropharyngeal cancer, but not in the oral cavity. This is something that is often misrepresented, is that HPV causes oral cancer, and that's really not necessarily true. In the oropharynx, the tonsil and the base of tongue, it has a better prognosis. It responds really well to chemo and radiation. In the oral cavity, it doesn't mean anything. So if HPV is found in an oral cancer, it doesn't really change how that cancer is going to behave. Still, I think it's important for us to recommend vaccination to our patients because there is a vaccine that can prevent cancer in people, be it cervical cancer or oropharyngeal cancer. So still important, but just remember that HPV is oropharyngeal cancer, tonsil and base of tongue, not oral cancer. And top 3 stains, Strong but Mish has entered the top 5. Highest answer streak of 6 and has joined our top 5 on a roll. Perfect. We're heading down to the final questions. Question number 12, where's the most common site for soft tissue metastasis in the oral cavity? So cancer from somewhere else is most likely going to show up in the tongue, the palate, the gingiva or the gums, or the lips. Where are we most likely going to see a cancer that spread to the oral cavity from somewhere else? It is indeed the gums, the gingiva. About over 50% of cancers from somewhere else, if they show up in the oral cavity, they're going to the gums. The second most common location is the tongue. So the 6 of you that answered that, it is the second most common. But yep, the 4 of you that said gums, very good. It is the most common site for cancer from another place in the body to show up. Oh, Mish climbing his way slowly but surely. Clay has increased to second place, but our top 3 has remained the same. Can we get a last minute upset? We did last season. We'll see. Maybe Chris can hold on to that lead. Question number 13, a squamous cell carcinoma of the tongue that is 3 centimeters and has a depth of invasion of 8 millimeters is a T1, T2, T3, or T4. We grade cancers based on a few different things, their size and the depth of invasion. T1 is the smallest, T4 is the largest and most aggressive. 3 centimeters large with a depth of invasion is a T2. We're going to talk a little bit briefly about what this all means in a second, but it is a T2. Looking at our leaderboard, Britta has bumped ahead, but our top 3 remains the same. I think that was a very, very tough question, but the College of American Pathologists, or CAP, set forth these guidelines. These are the most up-to-date guidelines. So a T1 is a small tumor less than or equal to 2 centimeters with a superficial invasion less than or equal to 5 millimeters. This case was 3 centimeters, which is greater than 2, less than or equal to 4, with a depth of invasion less than or equal to 10. T3s are pretty big and they dive pretty deep, more than 10 millimeter depth of invasion or more than 4 centimeters. And T4 is super aggressive, where it's really large and invading really large structures like the mandible or the skull base. So a tough question, and you don't necessarily need to memorize that, but it's definitely 3 centimeters and 8 depth of invasion is too large for a T1 and not quite large enough for a 3 or a 4. So it is a T2. A little insight in what we do. The penultimate question, a cancer of the lateral tongue is most likely to spread to lymph nodes in what location? Is it the cervical chain, periparotid, axillary, or supraclavicular? For those that are pre-dents or pre-med, cervical chain is along the neck, periparotid is around the parotid gland on the face, axillary is under the armpit, and supraclavicular is above the clavicle bone right here at the base of the neck. The cervical chain is correct. A lateral tongue cancer is most likely to go to a lymph node in the lateral neck. Periparotid is often a skin cancer or sometimes a parotid cancer. Axillary under the armpit is very common for breast cancer and often removed during breast cancer surgeries. And supraclavicular right above the clavicle is not uncommon in lung cancer. So cervical chain along the neck is where we can find a metastatic node in a lateral tongue cancer. And also why on a head and neck exam, you want to feel along the sternocleidomastoid muscle to see if you feel any lymph nodes that are suspicious for a metastasis. Are we ready for the final question? Well, first, let's see our standings going into our final question. And a shakeup. Mishra Mish has joined the top 3, with Clay dropping down to 3rd and Chris holding steady, but it's only a 427-point game. So it all comes down to this final question, and we've got a tight one here, a very, very close game, 1,000 separating the 1st and 5th place. So let's get into the final 15th question. What is the best way to prevent head and neck cancer? HPV vaccine, quit smoking, apply SPF lip balm to the lip with prolonged sun exposure, or all are excellent ways to prevent head and neck cancer. Now, I'm not saying oral cancer, I'm saying head and neck cancer. HPV vaccine, quit smoking, apply SPF lip balm to the lip, or all are excellent ways to prevent head and neck cancer. Very good. Yep. So HPV vaccine helps with oropharyngeal cancer. Quit smoking helps with pretty much all cancers. So that's always good advice. And applying SPF lip balm is very good for external lip cancers. So external lip is often ignored. We'll put sunscreen on our face, our nose, our ears, our forehead, but our lips also often get neglected. So it's really important to make sure that you and your friends and family and patients are using SPF lip balm to prevent a lip cancer or lip damage. So thank you all for tuning in. We really appreciate it. One final plug. Be sure to follow us on Instagram. I don't know, Brendan, do you want to say a few words? I'll unmute you here.
Thanks, Steve. Just forget about me. We want the Predent Mentor Map to help out pre-dental students. And if you are a current dental student, look like most of you are on this event tonight, thank you so much for coming. If you can, for your dental school and sign up on the Predent Mentor Map as a current dental student, it's just a couple questions that pre-dents might submit over the next few months, year, to get some more insight to your school. We'd super appreciate it. We really want to flip the script here and get these resources to be free for pre-dents to help them through this journey, make it a little less stressful. Thanks so much for coming out tonight. And Dr. Roth, as always, outstanding. Thank you. I love these. I learned so much.
Perfect. And hopefully everyone on the call learned too. I really did want to highlight our patients with oral cancer this month and hopefully spread a little bit of awareness and knowledge that you can take with you, not only this month, but every month. So without further ado, let's see who our winners are. In 3rd place, we have Clay, holding steady with that bronze medal. In 2nd place, we have Mish coming back, our dark horse. So 1st place, I have a sneaking suspicion it is Chris. Congratulations. all of you. With our runners-up, David and Britta, thanks again, everyone, for coming. If you are Chris, Mish, or Clay, please shoot me a message in the direct message here. We have lots of Michigan fans on the call. A part of me is crying inside, but I am proud of you. I will admit that I'm proud of the Wolverines on the call today. I've got Clay, and then I need Chris and Mish to shoot me a message or a DM on Instagram, just so we can make sure that we can get your Amazon gift cards. Everyone else, we will see you in July. Oh, Chris is going to be in Philly for residency. Yeah, definitely do want to go check out the Mooner Museum. It's really cool. All right, I've got Mish, I've got Clay. I just need Chris. I've got Chris. Perfect. Excellent. Thank you, everybody. And we will see you in July. Chris, Mish, and Clay, stay on the call real quick. I know that I think I have some of your emails, but excellent. All right, everybody. I got the emails, and we'll see you all in July.